So back pain, hip pain. How does it happen in tennis? This is where the biomechanics we just went through that you need to think about, all those things with momentum, inertia. This is when it's going wrong. Excessive bending. You're getting for your serve, you're bending way too far back. Now you're extending yourself too much. Anything where you're getting your body out of its normal rhythm is going to cause these things. Over or under rotation. Are you going too far over? Are you going not enough? Are you slowing yourself down because you're not following through properly? Torsional force into the pelvis. Tennis is a rotational sport. Everything you're doing, your trunk is moving side to side. When that happens, that torsion is probably the worst thing for your back. Besides tennis players, golf is usually the highest low back problems because it's completely all just swinging with your low back. Tennis causes pain, like we were just talking about. Requires a lot of more, large amount of trunk rotation and twisting of the spine. And with tennis serving, it hyperextends the lower back. Sometimes people go and toss. It's a bad toss. Oh, I'm just going to hit it anyway. Not a good thing. Okay? Because that'll compress the lumbar disc, and that can cause problems, bulges, herniations that we're going to go over. And the back muscles, if you think about it, even when you're not playing tennis, your back muscles are constantly firing because they're postural muscles. They keep you erect as a human being. So they're working, not only that, now you're taxing them even more because you're playing, you're moving around, you're going side to side, forward, back, up, down, every which way you can. Tennis uses every muscle in your body. More serious conditions that can happen with the low back. You can develop Facet syndrome. Where Facet syndrome is where you actually have the vertebra are actually now starting to rub against each other because you do have some cartilage in between there that helps glide, but what happens is if you keep gliding, keep gliding, keep gliding, keep gliding, you start friction, heat, you start tearing down the cartilage, and then you start getting to the point where you're decreasing the space there and you're actually starting to injure your low back. Radiculitis, that's radicular pain. People having pain going down their legs. Where the pain's going down your legs because the fact is there's a compression going into the nerves in the back as well. Fasciitis. That's where from doing a lot of the work, a lot of playing, a lot of the rotational forces, your body that strains your body. When your body gets strained too much, it starts to develop more of the layers of fascia onto the tissue and the muscles itself to stabilize the area. So now you're laying down more fascia, and now you're still doing the rotational forces. You're losing your range of motion as you're doing it, but what's happening is that fascia is getting layered on, layered on, layered on. Then it starts to cause pain because you're now needing to make up rotation somewhere else in the body. So before you might have had low back problem, now you got a shoulder problem. Now you got this going on because you have to make up the range of motion somewhere else in your body. And also then the nasty one that everyone's always worried about is bulging and herniated discs. This is your classic pain down the leg where it just, or you just can't walk anymore because the disc is putting so much pressure onto the nerve that you're just in excruciating pain a lot. I get a lot of people that come in my office with that barely can walk in because it's extremely painful. So those are some things that can happen in the low back for tennis injuries. Hip and pelvic pain. Right here I have the red area. If you look into the spine, that is roughly around where your center of gravity point is in the body. It's the S1, S2 cervical. Well, what happens is your body will take into account that spot to be stabilized. Your center of gravity must be stable for you to do any kind of motion whatsoever. If that gets altered in any way with any kind of pelvic torsion or sacroiliac instability where the sacrum actually attaches to the rest of the ilium, what that happens is now you have a twist or torque in there. Now you have to try to figure out your body's got to compensate for a twist or torque right at the center of gravity. So a lot of problems start coming right from here when you're playing tennis. And also, we are three-dimensional creatures, so the pelvis can actually, as you see here, anterior ilium, rotate forward, and it can also rotate backwards. So if you put any kind of twist or torque in that, think about it. If you look at these pictures, see the 40 millimeters, the 28 millimeters? What it's doing is raising and lowering. This is your hip socket here. This little bony guy here. So if it's raising and lowering that, and then your legs are off as well, now you're throwing off that whole kinetic chain even more. Okay? Knee pain. A lot of knee pain, I find, comes more from the hips because since there's a twist and torque in the pelvis, the knees are affected because the knees are a hinge joint. They're just like your elbow. You don't normally get elbow pain unless it's a tennis elbow. Tennis, and you're not doing it properly. The only reason we have so many more knee problems than we do elbow problems is because if you think about it, how do you walk on your hands or do you walk on your feet? If you walked on your hands, your elbows would be as much problem as people have knee problems now. A lot of times you can get over-contraction of the muscles, iliotibial band, which we're going to talk about a little bit, and the different hip flexors, and also rotational forces. This is where you're doing a lot of side-to-side, twisting, turning, running back, running forward, and impact forces. How hard are you hitting the ground? So this knee takes a lot of shock compared to the rest of the body because it's so much lower to the ground. Iliotibial band syndrome. This tends to be a lot with, I find this a lot with a lot of tennis players because of the fact that they are your lateral stabilizers. When you want to go ahead and move forward, they have to fire to keep your pelvis stable enough to move forward. That's how it is for a normal human being to walk. Well, over-contraction can cause a lot of pain. And even though it says with this picture here as the site of the IT band pain is down here, I see it anywhere up and down that entire muscle chain. It puts tension on the lateral part of the knee, so now it's pulling the knee out this way instead of having a balance on the knee. And it also, like I said, it affects the lateral movements because if you have a tight IT band on one side, it's going to be, it's going to be harder for you to stabilize as you're moving side to side because one side's more contracted. And then the nasty one in the knee, ACL and meniscus tears. Anyone heard of the unhappy triad? ACL, PCO, I'm sorry, and the medial meniscus. Well, this is what the ligaments in the knee look like, and this is the ACL. This is the nasty one when you hear a popping noise for certain people. I'm sure there might be a couple reconstructed knees in here. Those are nasty because of the rotational forces will tend to partially tear, sometimes fully tear. Now that happens at such an unstable part of the knee. You don't play for 6 months possibly. Granted, luckily surgery is getting much better now where recoveries are a lot faster, but not as much as you still like. There's that rotational force. Sometimes you hear popping. It tends to happen more on harder courts in tennis because there's not as much give to the ground. If you're playing on asphalt or concrete, there's no give. There's no cushion to it. It usually happens where, as you can see in our little picture here, he's turning. One leg is going one way, and the bottom part of the leg is going the other way. Right, like that. Okay? That's the nasty part where that happens. So that's where you hear that popping, because it's literally the ligament snapping in half. Sometimes you hear partial, but you'll actually hear that noise. It's a really weird sound. If you ever get a chance to hear it, I hope you don't. Yes. Like, you know, it's a weird noise, and it's not something you want to hear regularly. And now this is with our impact forces, chondromalacia patella. What it is that it's a blistering of the cartilage of the knee, and it involves with the lateral tracking of the patella rubbing against the cartilage until it gets irritated. As you can see here in the picture, this inflammation right here, and where the patella is, what happens is because if you're getting some lateral pressure coming from the IT band, the pelvis is twisted a little bit, the knee is not going to be riding properly. So if it's not riding properly, sometimes the patella then doesn't track correctly, because the patella is called a seismoid bone. It's a floating bone that's in your actual quad muscle. So what it is it's there to balance out the way the knee tracks. If it's pulling laterally, it's going to start rubbing that cartilage back and forth, back and forth, back and forth. And what happens is because you're just pounding on the knee, pounding on the knee, pounding on the knee to the point that you beat up the cartilage to where you get pain.